Hey guys, Dr. Dobson, and we're going to be doing some direct bonded veneers in this one. This took us about 3 hours to go from here to here, and we didn't do any prepping. This is just adding some Fuji to the facial surfaces of these teeth. So we'll get going with the footage here. I have about 2 hours of clinical footage to show, so it's going to be probably a longer one. The first thing we're going to do is, well, we froze with articaine, but first thing we're going to do clinically is just pumice the facial surface of the tooth where we're going to be bonding to remove any plaque. And then next thing we're going to do is pack size 1 ultra pack cord into the sulcus to push the gums back a little bit so we can try to bury the margin. And we're just going to do that with a perio probe. I like to use perio probes for cord packing because I find it's the best instrument for it, and it also keeps the tray setup more minimalistic, so you have less instruments for the assistant to have to deal with. And once we have the cord in, then we're going to matrix the tooth, and we're just going to use 2 mylar strips for that. So we're just going to place the mylar in between the teeth, and we'll do that for the other side. We're going to try to get it in the side of the sulcus closest to the tooth so that it bends in a little bit. And then we'll do the same thing for the other side. And once we're satisfied with our matrixing, we want it to look something like that. Then we're going to dry the tooth and then condition it for bonding. And we're just going to use a 5-second phosphoric acid etch. That's what I like to use for bonding Fuji or Equia Forte. And we're going to be using A1 Fuji in this one for all of the teeth. It's one of the nice things about using glass ionomer for this type of procedure is that you don't have to deal with like 5 different kinds of composite material. So we're just going to etch the tooth for 5 seconds with phosphoric acid and then rinse thoroughly, dry the tooth off, and Jackie's going to start mixing up a capsule of A1 Fuji 2 light cure. Going to put on our UV shield and then overfill the matrix. And then we're just going to pack it in a little bit with a moist cotton pellet like we always do. And then Jackie's going to light cure that. And then we're just going to start shaping the tooth. We're actually going to use a flame, fine diamond flame on a high speed. And the first thing I like to do is take the margin, the gingival margin, back to the surface of the root. So we're just going to kind of bend it in at about 45 degrees and reduce the material until we're back on the root surface. And this is definitely the most tedious part of the procedure. And then once we're back on the root surface at the gingival margin for the most part, we're going to use a wheel and just kind of pushing in from the outside of all the surfaces so that we have a nice kind of contoured shape. And then once we've done that, just going to fast forward through this. Like I say, 2 hours of clinical footage in this. We're going to use a finer grit wheel for the fine tuning, and there's still a little bit of flash around the distal gingival margin right around here. So once we're finished with this, I think we're going to go in with a fine carbide flame and reduce there until we're back on the margin. And we're just going to feel the margins for a nice smooth glide. And then I actually removed the cord here, which I regret doing because it started to bleed. And at the end of the procedure, we're actually going to varnish them with a resin so that they're nice and smooth and glossy. Because generally glass-based restorations are pretty rough to the tongue. So remove the cord, which I wish I didn't do, and just some final finishing. And then we'll move on to the next tooth, which is going to be the upper left lateral. And I lied when I said that we didn't do any preparation because the way that the lateral is rotated, the 2-2, it would have ended up sticking out quite a bit with the material added onto it. So we're actually just going to take a millimeter or 2 off of the facial surface so that we end up with a nice kind of uniform line around the smile. So we'll fast forward through that, and then we'll get to pumicing the 2-2. Pumice, we'll rinse and dry it, and then we're just going to matrix it like we did the 1-2 with a mylar. And then we'll do the mesial. Sometimes if there's a very tight contact, I'll actually take an explorer and just kind of wedge the teeth apart so that the matrix band goes in easier. And then we'll put that on the right side of the sulcus so that it bends in a little bit. And then that's going to be ready to restore. So we'll do the same thing to this tooth. Just going to dry it, etch it for 5 seconds, and then rinse thoroughly, dry it thoroughly, and then mix up the capsule of Fuji and overfill. And then we'll pack it a little bit with a moist cotton pellet. And then we'll light cure. We'll take off the matrices and then start reducing the excess material until we're back down onto the gingival margin all the way around the facial surface. And then once we're back onto the margin, we'll do a little bit of shaping with the flame here just because there was a lot of excess material on the surface. And then we'll go in with our wheel and continue shaping until it looks tooth-like. And then we're going to use some flame again here. And then occasionally we'll use a saw strip, a sandpaper strip for certain areas. The mesio buckle again had some flash, and the reason for that is because it's harder to tip the burr in that orientation if you're a right-hander. So we'll just use the saw strip to contour that. And then once we're happy with the shape of the 2-2, we'll do the centrals. Use the medium grit disc. And we'll get started with the little bit of extra freezing in the centrals here. Typically for the freezing, I think I just put half a cartridge into the lateral incisors, just the 2 injection points so that it spreads around. And then later we'll inject closer to the centrals so that the patient only feels 1 injection on each side. So we'll top that up, and then we'll get started on the 1-1 by packing a cord with our perio probe. And then same kind of procedure. Oh, I'm going to pack the 2-1 as well. And tuck the rest of it around the 2-2. And then same thing, we'll just put the mylar in between on the mesial. Oh, forgot to pumice, so we'll do that for both of the centrals. And then get the matrix bands on. Actually did use a wedge in this case here just to help the band bend just a little bit more. The nice thing is that you don't have to worry about making a contact since the teeth already have contact when you're doing these kind of direct bonded veneers. So we'll etch for 5 seconds. Dry thoroughly. And then overfill with Fuji. And I find that these Fuji capsules have just enough material to overfill it and then shape it a little bit with a cotton pellet. Pushing it just a little bit over the incisal edge. And then we'll cure, remove the matrix bands, and then start reducing the gingival margin until we're back on the root surface, nice and flush. And we'll use our wheel and same kind of technique, just kind of pushing in from all of the outside surfaces. You can actually see a little bit of the natural enamel there. And we'll shape that one fully, and then we'll do the 2-1. We'll use a medium grit, and then we'll do the 2-1's already pumice, so we're just going to put our matrix in. Both sides. And then we're all matrixed and ready to go, so we'll etch for 5 seconds, rinse, dry, and then apply our material. And a lot of people are probably going to be wondering what the outcome, like the long-term outcome is for using Fuji for this type of procedure, but you know, I don't think that Fuji really has any issues when you're using it in a non-load bearing area, and it doesn't debond. I don't think we'll have any issues with this stuff. I've done a few of these, and they all look the same as when we place them. So we'll contour the 2-1. And we were a little bit underfilled on the facial surface of this one, but we got away with it. And then once we're finished with the shaping of the 2-1, we'll go on to the canines. And there's a lot of kind of looking at the teeth and looking at them from farther away and seeing where you want to reduce to get them where you're happy with. But doesn't have to be perfect, because a little bit of asymmetry actually makes the result look more natural. So we'll get started with the canines. Packing a cord. And then we'll matrix. Pretty much the same thing for all the teeth. You know, once you've seen one of these, you've seen all of them, but I'll probably just kind of fast forward quickly through the last of it here. And etch, fill it up, cure, trim. Oh, looks like, okay, yeah. So this is the end of the footage. Unfortunately, we took a break and I forgot to turn the camera back on, but to finish, we basically just dried the surfaces of the teeth thoroughly, and then applied a resin, just an unfilled resin. Any kind of bonding agent works, just like you would with the Equia coat for Equia Forte, and that'll make the surfaces nice and smooth to the tongue. Yeah, this is a pretty easy procedure to do for, you know, a situation like this where you don't want to do ortho and crowns. Doesn't take too long, isn't all that technique sensitive. And patients usually walk out of the door with a big smile on their face.